Thank you very much. And I will hand over the time to Dr. Wong.
Thank you. Good afternoon. I have to congratulate the organizers. This is a really energizing event. I can still see the energy at this hour of the day after the whole day, and I really am impressed by the dedication, the passion of everyone here. So, but I got to go on with the talk. Okay. Yeah. I'm going to do this in 3 parts. I was asked to share about our Aging in Place program, but I didn't realize that the TriGen program that is very closely related to our program was going to win an award. So it's going to be a 2-in-1. Okay, that's the second part. And after that, you get up close with the team. Let's start. So, Alexandra Health System, what is it? We are the regional health system of the North. That means to say all the parts in red, brown, and green, those are the people living in those areas. We look after them. There's 800,000 up in the North, and we are the healthcare system that looks after them, helmed by our flagship hospital, Khoo Teck Puat Hospital. And in December last year, we just opened our Yishun Community Hospital. That's where we are, exactly in that spot there. Yeah. Now, I am sure this is not an uncommon situation, right? Where you come to hospital and you get admitted after a very serious illness, you get discharged to home. And then you're kind of left on your own, because in the hospital, the nurses serve you medication. If you went to the hospital, someone would be there to accompany you so that you don't fall down, right? And everything is packed nicely for you. Your meals are served in bed. And then 2 o'clock, you are discharged home, and suddenly, okay, you got to get your own medication. Was it the blue one or the pink one? 2 times a day, 3 times a day. Forgot. And then this one, do how? So there's a lot of confusion when you go home. The tube pull out, push back in. A lot of questions that suddenly what the nurses used to do, it's left back to you, right? And if you are a young person, or if you have learned this very well with the nurses, what they call caregiver education, you can manage it. But can you imagine if your caregiver is as old as you? 伊咪是講是苗唔知咧，伊講紅色唔是紅色嘅藍色啦，you know, right? You get that problem, and your caregiver is as old as you are, you know. So when things happen, what do you do? Who you gonna call? 995. Correct? Yeah. And then start all over again. Correct? Yeah. And can you imagine there are people who go round and round and round, discharge, go home, discharge, come back, discharge, come back. We call them frequent flyers. Affectionately lah, we don't, and we're not teasing them, but we really call them frequent emitters. And you know, as doctors and nurses, we are very proud of our work, you know. Then you say, how come I discharge you nicely? Then you come back like that. What did I do wrong? I didn't do anything wrong, but there is a lot of difference between hospital and home care. You know, you got a $1 million bed environment per patient in the hospital. You go home, all right, the bed is too low. You want to sit down, also, fall down, right? You don't have diapers around, you don't have nice disposal bin, nothing. You just have to make do with whatever you can. So the home environment is very, very different from the hospital environment. And so that is the reason why when they cannot handle, they come back. So what do we do in Aging in Place is that, you know, when you're at home after discharge, you're thinking of 995 already. You see right? The thinking already, huh? Okay? No. So what we did is we sent out this heroic team of nurses who go to the home to visit the patients and find out, what's your problem? How can we help you? How can we help you continue that care that you have received, right? And not only that, we find that, in addition, you're not walking very well, right? I will get the therapist to come in. Maybe let's do some home therapy. Get the pharmacist in, check your medications. Sometimes, don't have money to buy the wheelchair that you needed, the social worker will come in. So there's a whole team of people doing that. And hopefully, when that has happened, you can be independent back again. And that's the whole idea of the Aging in Place team. Yeah. So up in the north, where we are, what we do is we send out teams of nurses to go in. That also includes therapists, pharmacists, social workers, to go and help people. Really, what is it you need? What matters to you? We are there to answer the question because we understand that the healthcare system is really very complex, too complex for a lot of people to navigate. Sometimes even I forget. Yeah. So as a team, we have collective wisdom. Yeah. So I'm going to share this with you. This is the story of Mr. Low. Oops. I think we have to cock our head a little bit.
This is what happens after tea break, is it? We get a bit topsy-turvy.
Do you want to watch it this way?
Are we able to tilt it? Or are we going to... Okay, he said we're good to go. Maybe slightly tilt. You see, we started the day with the chicken dance and we ended with a slight tilt. Okay? No, they're going to sort it out for us, don't worry. So perhaps, Dr. Wong, you can share with us a bit about the video first while we're trying to get it loaded up.
So, going home is not the last thing, because if you go home, you don't come out of your home, it's just as trapped, right? The best thing is if we can send you home, but also to reintegrate you back into the community. And that is what Mr. Low's story is about, not just going home and sitting down at home. But for him, we also connected him directly to the day center, and now he's really happy that he's still there at the day center. So this is a real recent story.
We might need a bit longer just to sort it out, so we don't have to all tilt our heads sideways. Would you like to go on with the presentation first and we come back? No, they say okay, can.
Oh, okay.
Can run, okay. Go on, or is that okay to go? Ta-da! Okay. We can hear Mr. Low's story. Or maybe the presentation first.
Show you this? Oh no, it doesn't. Yeah, when things like that, you whistle a happy tune.
We just needed that line from you.
Bed, dressing, and with many more activities most of us take for granted. He had a stroke last September, and his wife, daughter and helper have been looking after him since he was discharged from KTH in December. But sometimes, even the most supportive families need extra helping hands. Mr. Lowe was referred to the Aging in Place team. Senior staff nurse Agnes Wong visited the home twice a week at first to teach the family how to care for Mr. Lowe, and they quickly gained knowledge and confidence. Agnes also linked them up with other care agencies to help them cope. Senior healthcare assistant Amy from Thai Park Home Care Services now visits the home 3 times a week to help save Mr. Lowe. His condition is now stable, and Agnes has handed over his care to the Home Nursing Foundation. Senior staff nurse Pushpa visits Mr. Lowe once a month to monitor his health and address any concerns the family may have about his care. Mr. Lowe also goes for rehabilitation 3 times a week at St. Luke's Elder Care. Physiotherapist Jennifer encourages Mr. Lowe to push himself during the sessions, and his hard work is paying off.
As someone once said, the smiles are all worth it, right? And are we back? Yes. Another of our recipients, Mr. Quack. And in this picture, I actually want to introduce the students. Now, the students came to us. We didn't go to them. They came to us and said, can we help? Okay. They formed themselves. These are students from NUS, medical students, nursing, pharmacy, and social work. They gathered together, formed themselves into teams, and said, we want to help visit these patients. And so our nurses actually mentor them, taking on these nurses to visit their patients in their homes. And in the process of doing it, the students were giving cheer to the people. I always said, if you want to add energy and laughter to anything, add children. Yeah. If you want to add wisdom, add seniors. And the most important thing, take up the doctors. They are too serious to have anything, and they know too much to have anything. So yeah, this is the right match. And actually on stage today, I also want to introduce the team to you afterwards. And so they started this called Tri-Generational Home Care at Northwest. Northwest because Northwest CDC came in to facilitate the whole collaboration and is actually financially supporting them in some of their needs. So the next sharing, this is how they came to be. The 2 founders. Believe me, they are still smiling like that. They just started work. And now I'll let you get up close to the team. Assembled on the stage today, we have Yao Yan, who's our senior staff nurse from Aging in Place. One of the many daily heroes who go out to patients' homes every day. Okay. Next to her, Madam Lee So Lui. Okay. I want to tell you more about this very, very brave lady. Okay. She is a survivor. Not once, 4 times. She had 4 scares in her life. Luckily, the first one of them was benign. One of leukemia, she's in remission. Third one, she had pancreatic cancer in 1995, and she had a major surgery called Whipple's procedure. In my day, that is a very complex surgery. Very few people survive. And very few people live long after that. But by 1995, quite good already lah, Singapore. So she lived 20 years. 2015, she had a recurrence. And she had to undergo a second surgery. And you know that second surgeries are always very difficult because the anatomy inside is already different. Yeah? And as a result of that difficult surgery, she had poor wound healing, and that took a long time for her to recover. But as you all would know as well, the pancreas is actually involved in insulin production. So if your pancreas is taken out, what happens? You literally become a diabetic overnight. And that is what she has to live with since 1995. And with that kind of surgery, she has been going up and down. Her sugar levels will go to 27, 20, and then down to 2, right? And of course, with very high, you can't function. Very low, you can faint. It almost looks like a stroke sometimes, right? And that is what she had to live with, falls and recurrent collapses as a result. And that was why it was so difficult for her to manage at home, and that was how we started visiting her at home. And in addition to that, Ping Yan is our Trigen team leader that visits her. He's a final year medical student in NUS. And next to him is the young lady, we have got hopes for her, Amanda Lim. She's from West Spring Secondary School. We have to bring them out. Yes. So I'm going to bring, they're going to say, they have prepared something to speak to you, and then you can ask them questions, okay?
Afternoon, everyone. I'm Nurse Yao Yan, come from Khoo Teck Puat Hospital Home Care Team. Hello. Okay. Yao Yan here, come from Khoo Teck Puat Hospital Home Care Team. So today I'm very happy to sit here. Just now I saw a lot of speakers stand and talk, and now we have very comfortable sofa, yeah, to sit. Yeah. So I'm very happy to share like how our home care team work together with our patient and also the Trigen student. We work together and achieve our care goals. Okay, this is Madam Lee So Lui. I used to call her Auntie Sally. Yeah, our first time meet Auntie Sally is 2014. Like just now, Dr. Wong shared about frequent flyer. She is one of frequent flyer. She frequently admitted to our Khoo Teck Puat Hospital for hypoglycemia. The sugar is low. Yeah, she fainted at home and she come in admitted. So of course, our main focus is on diabetic control to prevent hypoglycemia and hyperglycemia. Yeah, so we are working on few areas. So the diet, we encourage healthy diet. We give her a diabetic booklet so she can like choose the healthier diet lah. Then we also go through her medication and we check her insulin injection technique, make sure she's competent. And most important, we also encourage her to check her sugar at home. So until now, Auntie Sally also checking her sugar like 3 times a day. So we also work very closely with our doctor, and so the doctors can, based on the recording, to titrate the medication insulin timely and accordingly. And we also educate on hypoglycemia treatments. So now she's expert already in treatment. Yeah. So actually, I think every nurses and doctors like knows all this method very good. Yeah. But we also knows like who like whether all this method can work out or not. It depends on our patient. But luckily, Auntie Sally is a very good patient. Yeah. She's like just now, Dr. Wong said she went through. She not only have like type 1 diabetes, she also got other like complaints and chronic medical problem. But she still stays very strong. She's also very positive. Yeah, see, she smile already. Yeah. Okay. She is very cooperative with our care plans. So, like you know, nurses and doctors we like this kind of patient, like you know, less question and follow the instruction. Yeah, she is. Yeah. So until now, she just now I say she's still checking her sugar, and also she aware about hypoglycemia treatment. So she pre-prepare a lot like glucose water, standby at her house. Not only one bottle, with like bedroom got one, right? Then living room different counter, you know, sofa and the dining table too. Kitchen also have, right? Auntie Sally, 厕所有没有？ Yeah, so with Auntie Sally's cooperative, so everything runs very good. So we are able to achieve our care goals. The frequency of hypo episode is reduced a lot, and we are able to stop her from admission to our hospital for almost 1 year for hypoglycemia. Like there's no admission for her. Yeah. Then I think after we follow up with her after 5 or 6 months, her condition is quite stable already. So it's the time the tragedy student step in. We are very happy. Yeah, you know our nurses is very busy, so it's like we are very happy there's someone to come in to help us. Yeah. So to me, I think they are our eyes, our ears. You know, they visit patient not only befriender. So if there is any issue, they will contact us. We will work out together to solve the problem. Yeah, I think I will leave the time to the student to let them to share their experience. Yeah, Auntie Sally first. Auntie Sally Auntie Sally 要讲一些事啊。
我首先跟大家问声好，希望你们都健健康康。我很谢谢这边主办的那个他们的来我家照顾我，尤其那位小朋友，还有另外一位，他们来到我很高兴，我真的把他们当作是我的孙女，我很高兴。对不起，我不会讲英语，我只会讲华语。所以如果不会听的，就我没办法了。还有这位医生，他也是很关心我们病人。他知道我会煮一点东西吃，他去买一本烹饪的书给我，说吃糖尿病的。我有试过来煮。不过我的手艺不好，我自己觉得我能吃得下，能吃得饱，我就好了。我没办法学到他书里面所写的那样，我没办法。可是我很开心，他们总共4组来到我家，每一组的都不一样，每一组的都很好。都真的是很关心老人家，所以我是希望能够多一点，如果需要的这样的情况的人，希望你们能够真的分多一点，训练多一点人，那么给我们这些老人家开开心心的过这个日子下去。希望大家都能健康快乐。
Good afternoon, everybody. My name is Ping Yen. I'm a final year medical student from NUS. So today I've been told to share with everybody how, together with the help of the secondary school students, we have actually helped Madam Lee or Auntie Sally cope with her chronic diseases. But unfortunately, I think I will not be able to do that today. And the reason why is because by the time we were introduced to her, she's already very, very competent in caring for herself. Be it medication-wise, the appointments with the polyclinic or at the hospital. She had everything in control, and she was very knowledgeable about her diseases and the medications, and even to how to respond to emergencies like hypoglycemic episodes, for example. So allow me to instead share with everybody how Auntie Sally has helped us, the secondary school students and myself, in this past 6 to 8 months. So firstly, I'll start with how I think she has benefited the secondary school students. So when I first met Amanda and Clara, which is the other secondary school student who's unable to be with us today, they were slightly more reserved and they were quieter. And over the 6 to 8 months that they interacted with Auntie Sally, I could see that they stepped out of their comfort zone. They have grown to be more comfortable with speaking to the elderly, especially so in Mandarin, because nowadays kids don't, okay, I'm a kid, but kids don't speak Mandarin all that well. So yeah, and they've also taken more responsibility. Like towards the end, as we bid farewell to Auntie Sally towards the end of our cycle, we actually took a group photograph, and they took up the responsibility to develop these photos, to frame it up nicely in a photo frame and to deliver it to Auntie Sally. So I would like to congratulate Amanda and Clara for growing through this experience. Yep. So next, how Auntie Sally has helped myself. So as a final year micro student, it's very easy for us to get lost in studying and in preparing for exams. We often ask our peers, have you seen Mr. Tan in bed 17 with the extra hard sound? Have you palpated the big liver in Madam Tan at Ward 17, bed 7? And nobody wants to spend time with Mr. Lee, who wants to tell you his life story, or Madam So, who is so eager to tell you about her hobbies. And it's through experiences like meeting Auntie Sally which reminds me why I chose to do medicine or why I chose to become a doctor in the first place. While our visits to Madam Lee might have been one of the many activities or many things to do in our busy schedule, our visits to her may in fact be highlights that break the monotony in her life. And I think this principle would stay with me when I start work. And when our consultants are too busy to spend more than 5 to 10 minutes in morning rounds or in clinic with our patients, the junior doctors are often the ones they will turn to answer their questions, to allay their fears. And I sincerely thank Madam Lee and everybody who made this experience possible to have helped me grow in these past 6 to 8 months. Yeah. Okay, so now I'll hand the remaining time to Amanda to share with you her experiences.
Yeah, hi everybody, my name is Amanda. I'm from West Spring Secondary School. So as a student, right, most of your life is devoted to studying and just slacking. So like apart from those two things, right, I don't really have much else to do. But thanks to tri-generational home care, I managed to like gain new friends and experiences. For friends, right, I managed to meet Madam Lee, and as well as Ping Yan and my other team leaders. And furthermore, like after making those fortnightly visits to Madam Lee, I learned like how to keep track of her blood pressure and also her sugar levels. Technically, based on my own personal life, right, my father is a diabetic who also has high blood pressure. So like when I see Auntie Sally, I can kind of relate because I know like what my father is going through. I know what she's going through, and like after getting to know Auntie Sally, like I know how to take care of my father. I know how to make like his his sort of troubles easier to go through. And also, it's quite nice because like when you're a secondary school student, most of your friends are like your age. You know, I'm 15, and the only friends I have are like 15, 17. So like after all these visits, I have one more friend, and I also have Piniana. And also, because my grandmother lives in Malaysia, I don't have a lot of time to visit her. So, technically, Auntie Sally is like my other grandma. Okay, that's all I have to say. Thank you.
We are open to questions if you have any and you still have time.
So if anyone has any questions, we will be more than happy, the panel here will be more than happy to take the questions, either from the theatre here or from the conference room. Oh, we've got several hands already.
I believe many people are very concerned, including myself. Nowadays, you see, you go to the market or supermarket, the vegetables are very huge. The fruits also very big. So we're wondering, the farmers overseas, what they do, what do they put as the fertilizer that make the plants so big? Is it we as consumer become toxic when we eat? Is it because of this that resulted in people, so many of them, having diabetic, stroke, cancer, you know, the leg twisted.
So what we consume, is it? What is in the food?
Should we do investigate on this? And also the coffee, tea we drink, all in plastic cup, you know. So does this cause toxic to us? We also don't know.
Dr. Wong, you're probably the person to answer the question.
It's a very interesting question. Yes.
Didn't expect that question, did you?
No. I didn't see that coming. But thank you for
We
the
blindside
question.
you, huh?
Yes, but you're right. We should be looking at what we're eating. We should be looking closer at what we are doing in our lifestyles because
Should
our
go back to organic.
That's a different question. Yeah.
Okay, perhaps I think it would be best if we could take it offline with
Yes,
Dr. Wong on
that's
that
right.
question. Thank
Sure.
you very much.
I think
Next question.
Yeah.
We've got one gentleman over there.
Yeah, my question is about this home care team. This home care team, do you provide to people who are staying alone or people who have a family but you know they are alone most of the time at home? And do you charge for this team to visit them other than the volunteers from the NUS? And how do they apply? Is it
So what are some of the criteria, is it? That you're asking?
Is it a pilot project you're doing or is it something that's on?
So this program has been on since 2011. So that time it was a pilot project. There were endowment funds that gave us some money to try it out. The program is now actually being adopted by all the regional health clusters, regional health systems in Singapore, but the funding mechanism is not determined yet. But for sure, to be sustainable, there must be a form of co-payment because it is actually very labor-intensive to send nurses out there. Yeah, sometimes the doctor has to also go out there. Currently, our nurses go in and do not charge for their services. But if they require a doctor's visit, a therapist visit, a pharmacist visit, there will be charges related. So that's why I say the nurses are the heroes because they go in and do a lot more than just nursing. They go in, they actually can assess a person for rehab potential. They actually go and try and do a first layer of medication reconciliation. They do environmental assessment. They are actually the universal soldier, you know, that does a lot of all this so that there's less need to charge when a therapist or a doctor goes in. So they do a lot of first layer, but comes to a point where it's beyond their capability, then we do have to send professionals to back them up. Yeah, so that's when it's chargeable. I think we are looking at how it will be made affordable to people. Who gets to go into this program? You need to fulfill certain criteria. So for example, what we call frequent flyers. That means you keep coming in for the same problem. Obviously, we haven't sorted some problems for you. And that's why we need to understand what is causing the recurrence of these symptoms. And there are factors in your home that may be contributing to this that we don't see when you come to the hospital. So that's why going to the home is very important. And that's how we select the patients.
Okay,
Thank you. We've got a question for this gentleman. We will take that last question.
Hi, Dr. Wong and team. I'm Rafi from Singapore General Hospital. Okay, apparently that I have 2 or 3 questions lah.
Alah, when I say last question, then you merge it to 2 or 3 questions.
Okay, so technically in the wards, right, how do you actually identify your patient to enroll in your program? As I know, one of your identifiers are frequent flyers who is admitted about 3 times in a year. So, other than that, do you have any other criteria?
Yes, we do have. So one is a technical recruitment, right? The minute you hit your 3rd admission, the day you are admitted, and that day is the first day of your 3rd admission, your name is flagged up. So that's a system call-up, right? But then there are some that miss. You may come in for very catastrophic illness. You need the same kind of care, but it's your first visit. So that one, we rely on the clinical staff to identify this. So we have care coordinators in the ward that actually will identify this. The primary care team, the clinical team in the wards will also flag this out and refer to what we call our triage office. So that's a small office that actually receives all these referrals, and then our nurses will be activated to go in. Yeah? I think if you are interested in this, our next group that is presenting this is also going to show you another version of what home care is about, and the team from EHA is going to be sharing something with you as well.
Okay.
She's passing the bucket to you all right now.
No,
Next.
I think
Sharing
that
the
there are
bucket.
many groups, every hospital, every regional health system is really trying to do something, and we are learning from the best. We are actually trying to have best practices shared across the regional health system so that we can have one great health system in Singapore.
Fantastic. We like the sound of that. One great health system all together. We collaborate together, right?
Yes.
Correct. Thank you,
Part
Dr.
two?
Wong. Yeah. The next question will be, once you enroll the patients, for how long would you actually hold your patient? And then thereafter you will hand over to community partners, I believe. Yeah.
So traditionally, we will do a transitional care 3 months to 6 months. When we started aging in place, we did not think that we would discharge them. But it was way too long to hold these patients on our program. And there was a point in time we were seeing our patient load rising, no discharges. So we had to make a practical decision. So it's very heartbreaking for the nurses who have held these patients for so long to discharge them. So we do have to put some tick boxes. So if the patient is able to look after herself, they have handed over, taught, and they can back demonstrate good care techniques, good caregiving techniques. That is one qualifying criteria for discharge. Yeah. One of the others is that they don't get admitted back again. So we have patients who don't get admitted again, and there are others as well. Yeah.
All right. In the interest of time, I have to hold you there. You have other questions, you can please approach Dr. Wong and the team.
We'll be
after
willing
that.
to come down and talk to you, share with you if you are, and to anyone who wants to understand more, we'll be happy to share. Yeah.
Sure. Thank you.
Once
Dr. Wong.
again, can we please give a big warm round of applause to Dr. Wong as well as the team, Ms. Yao Yan, Mr. Yeo Pin Yan, Ms. Amanda Lim， 还有谢谢李女士今天抽出时间来跟我们分享您的故事，谢谢。And as they mentioned, right, if you have any more questions for them, they will be around after the conference as well. So please do take this opportunity to approach the team, right? Yes, Ping Yan? Yes? You will take all the questions.